Hi, I'm Hope Friday from the Diabetes Center, and I'm here to talk to you today about your blood sugar numbers. I know you're all already testing, and if you haven't, this is going to give you a good idea of where your blood sugar should be once you start testing. Blood sugars, once you find out you have diabetes, should range between 80 and 120 first thing in the morning or after not eating or drinking anything with calories for 8 hours. It also should range 80 to 120 if you're testing before meals and it's been 3 to 4 hours after the last time you've had a meal or a snack. 2 hours after eating, your blood sugar should rise slightly and you should run between 100 and 160. Going to bed, we'd like to see your blood sugars a little bit higher. So 100 to 140 would be an acceptable level to go into bed. You should be testing anywhere from 1 to 6 times a day, depending on what your doctor and diabetes specialist had recommend. If you're on oral medications, usually it's once a day, sometimes twice a day, and they alternate it between before meals and 2 hours after. On insulin or an insulin pump, you might be taking it up to 6 to 8 times a day, varying between before and 2 hours after. So every 3 months, you should have some lab tests done with your physician, one of those being a hemoglobin A1C. A hemoglobin A1C is a 3-month blood sugar test with a memory. And what it does is it gives us an average on what your blood sugars have been running from the day they draw your blood backwards 3 months. Someone without diabetes, their A1C runs between 4 and 6%. So with diabetes, we want to keep you as close to normal as possible. An A1C of less than 7 would be your goal. So you want to keep an idea of how your blood sugars are doing. If you keep in those goals we talked about just a minute ago, about 75% of the time, you should have an A1C of less than 7. If your A1C is higher or lower than that, that might be a conversation you'd want to have with your physician. There are also several other numbers with diabetes that you should be aware of. Cholesterol, you should have that checked yearly. You should also have microalbumin, which is a urine test to see how your kidneys are functioning. And you should also know what your blood pressure is running. I recommend meeting with your healthcare professionals regularly to talk about these numbers and see what you need to do next and to make sure you've had all these numbers done. For more information about your blood sugar numbers, what they mean, you can call the Diabetes Center here at Trinity Regional Medical Center, 515-574-6350. Thank you.